now we had seen about the various acute inflammation. Let's move on to chronic inflammation. So chronic inflammation, as I previously mentioned, it is going to be of prolonged duration and of a delayed onset, and usually it is directed against organisms or some offending agent which is difficult to eradicate. So suppose there is a very highly virulent organism, so that will lead to a chronic inflammation. Or sometimes when there is an environmental agent or self antigens in autoimmunity. So in those cases, there is no way you can remove this antigens, right? So in that case, it will always trigger chronic inflammation. Chronic inflammation is going to be a composition of chronic inflammatory cells associated with tissue injury and repair. So both injury and repair is happening simultaneously. Out of this tissue injury is considered as the hallmark of chronic inflammation. So the inflammatory cells involved in chronic inflammation will be lymphocytes and monocytes. And repair is going to involve two processes mainly, which is neoangiogenesis and fibrosis. So what are the causes of chronic inflammation? I have already told. Any persistent infection with a virulent substance, or autoimmune or environmental antigen, or prolonged exposure to any toxic substances, suppose silicosis. So silica, it's a foreign material which is going to be toxic. So prolonged exposure to toxic substances again will trigger chronic inflammation. And the most important cell for chronic inflammation will be a macrophage. So macrophages are the most important chronic inflammatory cell. So macrophage usually has various functions. The first function will be phagocytosis, we had already seen. And these are also antigen presenting cells. So whenever there is an antigen, they will take up this antigen, process it, then associate it with the MHC molecule and present it to the CD4 T helper cells. So that we'll be reading in detail when we go to immunity. Okay. Apart from that, this macrophages secrete lots of cytokines. So cytokine secretions. Then finally, macrophages are involved in repair, especially the M2 macrophages. So macrophages have various functions. They are being given various different names depending upon the site in which they are going to be present. So in the brain, they are going to be called as microglia. While in liver, it is going to be called as Kupffer cells. Kupffer cells. In spleen, they are called as littoral cells. In lungs, they are called as alveolar macrophages or dust cells. In kidney, they are called as mesangial cells. In placenta, they are called as Hofbauer cells. In synovium, they are called as type A synovial cells. And in connective tissue, they are called as histiocytes. So let's see about the classification of macrophages. We have two major types of macrophages, which is M1 macrophages and M2 macrophages. So M1 is the classical macrophages and M2 is going to be the alternate macrophages. M1 macrophages are usually activated by interferon gamma. So interferon gamma is a mediator which is going to be produced by the T helper 1 subset of cells. While M2 or alternate macrophages are going to be activated by interleukin 4 and interleukin 13, which are going to be produced by the T helper 2 subset of cells. And this M1 macrophages, once activated, they are going to produce certain interleukins themselves, which are interleukin 1, 2 and 12. And this interleukin 12 will go and activate the lymphocytes, the T lymphocytes again, okay. So these interleukins which are responsible for their activations and whatever and interleukins they are producing are quite important. They are specific also. So M1 macrophages are activated by interferon gamma produced by T helper 1 subset, while they are producing interleukin 1, 2 and interleukin 12. And the function of M1 macrophages is going to be pro-inflammatory, that is phagocytosis. While M2 macrophages are activated by interleukin 4 and 13 produced by T helper subset 2, and they are these M2 macrophages are going to produce anti-inflammatory cytokines like interleukin 10 and TGF beta. And these M2 macrophages are the ones which are responsible for repair. Okay. So here I mentioned that the chronic inflammation is going to be responsible for repair. And here again in macrophages, I told repair, right? So it is because of this M2 classification of macrophages. So now we had seen about macrophages. Let's move on to the next type of cell which is involved in chronic inflammation, which is lymphocytes. We have two sets of lymphocytes, B lymphocytes and T lymphocytes. We are dealing with the T lymphocytes only here. T lymphocytes are again subclassified into CD4 positive T helper cells and CD8 positive cytotoxic lymphocytes. Then the CD4 positive helper lymphocytes are classified into TH1 subset, TH2 subset and TH17 subset, out of which the TH1 subset is going to produce interferon gamma. So this was the one which was responsible for activating the M1 macrophages, right? And TH2 subset is going to produce interleukin 4, 5 and 13. This is going to activate the M2 macrophages. Apart from that, this interleukin 4 is also responsible for the production of immunoglobulins from the B cells. So this interleukin 4 will activate the B cells and cause immunoglobulin class switching. And interleukin 5 is responsible for activation of eosinophils. Okay. And this interleukin 13 was also an anti-inflammatory cytokine. Remember, all three together will activate the macrophage M2. Then TH17's subset of T helper cells are going to produce interleukin 17. Interleukin 17 again I had already mentioned that it is going to be a chemoattractant for neutrophils and monocytes. So normally what happens? These macrophages are going to produce interleukin 12. Remember, the M1 macrophages produce interleukin 12 and that is going to activate the T cell. Apart from that, this macrophage is going to act as an antigen presenting cell. So it is going to process the antigen and present it to the T cell in the context of a MHC molecule. So this T cell will be activated and the T cell is going to produce either interferon gamma if it is a TH1 subset, or interleukin 4 or interleukin 4, 13 and 5 if it is a TH2 subtype, which is going to further activate this macrophages. Then we'll see about granulomatous inflammation. So granulomatous inflammation is a specific type of chronic inflammation which is classically defined as the presence of epithelioid macrophages in the center surrounded by a collar of lymphocytes. So already when we were discussing about tuberculosis in the previous chapter, we were discussing this granuloma. So in the center there may or may not be necrosis. So in tuberculosis we have caseous necrosis, but sometimes we may not have this necrosis like in a sarcoid granuloma or even a Crohn's disease granuloma. So surrounding that, we had this epithelioid macrophages, which are nothing but modified macrophages. They appear quite big and like an epithelial cells. That is why they are given this name epithelioid. And their major function will be secretory function rather than the phagocytic function. Though these are surrounded by these kind of Langhans giant cell in tuberculosis, which have this horseshoe-shaped peripheral nuclear arrangement. Then surrounded by the collar of lymphocytes. So this is the classical appearance of a granuloma. So we'll see about the various examples of granulomatous inflammation. So we have both infective causes and non-infective causes of granulomatous inflammation. So under infective causes, the most common one was tuberculosis. Tuberculosis can produce both caseating and non-caseating, but most of the times it is going to be a caseating kind of a granuloma. Then other infective causes of granulomatous inflammation are leprosy, especially the tuberculoid leprosy. Then syphilis. In the syphilis, the stage of gamma is going to be a granulomatous inflammation. In malaria, it is going to be called a Dirk's granuloma. In cat scratch disease, it is going to be caused by Bartonella henselae, and it is going to be caused by causing a stellate granuloma. In Q fever, again, it is going to produce a fibrin ring or a donut granuloma. Histoplasmosis, blastomycosis and coccidiomycosis. These are again infective causes of granulomatous inflammation. Under non-infective causes, we are going to have sarcoidosis, which is going to produce a naked granuloma, that is, the collar of lymphocytes is not going to be present. And it is a non-caseating kind of a granuloma. Again, in Crohn's disease, which is a inflammatory bowel disease, here again you see non-caseating granulomas. Other than that, we have various vasculitis, especially the large vessel vasculitis like the temporal arteritis. It is also called as giant cell arteritis. Then Takayasu arteritis. Both of these are large vessel vasculitis. Then we have small vessel vasculitis, which are pauci-immune. So pauci-immune small vessel vasculitis like Wegener's granulomatosis, that is granulomatosis with polyangiitis. And then eosinophilic granulomatosis with polyangiitis. So this is the Churg-Strauss syndrome actually. and this is the Wegener's granulomatosis. So stellate granulomas are, this is the image based questions, this can also come. Stellate granulomas are nothing but star shaped granulomas basically, but here it is going to be composed of neutrophils. Star shaped and it's composed of neutrophils, and it is going to be seen in cat scratch disease. Then we see this kind of cerebral malaria. You have this formation of Dirk's granuloma. So inside the vessel, you can see parasitized. This is the vessel, and in this you can see some dark brown spots, right? So these dark brown spots represents the malaria parasite actually. So all of these dark brown spots are malarial parasite. So the RBCs which are parasitized by this malarial parasite is going to be present inside the vessel, and around this parasitized RBCs we are going to see an inflammatory response which is looking like a granuloma. So this granuloma is given a name called as Dirk's granuloma. Then next is a fibrin ring granuloma or a donut ring. So doesn't it look like a donut? So there is an empty vacuole in the center composed of lipid. Surrounded that we are seeing the inflammatory cells forming the granuloma, and it is going to be seen in many conditions, mostly in Q fever, and you can also see it in Hodgkin's lymphoma. Now that we saw about the Langhans giant cell and tuberculosis, let me highlight about the other type of giant cells as well. So the physiological types of giant cells include syncytiotrophoblasts. Syncytiotrophoblasts was one of the trophoblastic cells seen in the placental villi, right? So syncytiotrophoblasts is a multinucleated giant cell. Other than that, we have osteoclastic giant cell. Then megakaryocyte, which is the precursor for platelets. So all of these are physiological giant cells. Under pathological giant cells, we have Langhans giant cell, which has this peripheral horseshoe kind of nuclear arrangement. So this is seen in tuberculosis. Then we have Touton's giant cell, in which this entire cell is going to be having some cytoplasmic vacuoles. So in this you can see lots of cytoplasmic vacuoles, and in the center if you see, the nucleus is all arranged in a floral like pattern. So some cytoplasm is seen inside it. So this is the cell, and there is lots of cytoplasmic vacuoles, and in the center the nucleus is arranged like a floral arrangement with some cytoplasm inside it. So this kind of giant cell is called as Touton's giant cell, seen in xanthoma. So xanthoma is a condition in which there is lots of cholesterol deposition in the dermis. So in a foreign body giant cell, this is the foreign body giant cells. Here there is multiple nuclei which is all arranged haphazardly. So this kind of haphazard arrangement of nuclei is seen in a foreign body giant cell, and it will be seen in any foreign body reaction. So suppose there is a silica particle or some talc particle or some suture. So around that there is going to be a granuloma formation in which you can see this foreign body giant cells, and these giant cells will be trying to engulf the foreign material. Then the Reed-Sternberg giant cell. So Reed-Sternberg giant cells are seen in Hodgkin's lymphoma. So this is a very classical image. It is also called as owl eye appearance. In this, you are going to have a binucleate nucleus, which is exact mirror image of each other. And inside the nucleus, you are going to have a prominent eosinophilic nucleoli. This is the most important feature of prominent eosinophilic nucleoli. And around this nucleoli, you are going to have a halo. So this is the halo, which is seen around the nucleolus. So this kind of cell is called as a Reed-Sternberg cell, seen in Hodgkin's lymphoma. Then the next type of giant cell will be a Warthin-Fingaldi giant cell. This Warthin-Fingaldi giant cell is a cell seen in measles infection. So here it is going to have intranuclear eosinophilic inclusions. So this kind of intranuclear eosinophilic inclusions can be seen in measles, and measles can cause a type of pneumonia called as hex pneumonia.